Cervical Cancer Awareness Month. Did you know that cervical cancer is the #1 leading cause of death in the world for cancer-related deaths for women? Well, we decided to invite Dr. Lindsay Willmott from the Arizona Oncology to talk to us about this very important subject. Dr. Willmott, thank you for joining us and good morning to you. This type of cancer is relatively easy to detect, even cure, but we have to stay on top of our screenings, right?
And that's what the pap smear is. It's actually specifically to look for precancerous changes in the cervix. But the goal of cervical cancer screening is to try to detect a precancerous lesion that can be accepted and then cured. If for whatever reason someone hasn't been going into their gynecologist, they can present with signs of a more advanced cervical cancer, which is obviously what we're trying to prevent.
In between screenings, are there signs that we should be looking for?
So the more common symptoms that people kind of experience with an actual cancer include irregular bleeding, spotting after intercourse, and also pelvic pain. Those are probably the most common symptoms that patients will report. And so I have a number of patients who, when you're younger and you're accustomed to going into the OBGYN so that you can get, for example, your birth control prescription, or if you're of childbearing age and you're having your children and you're going in to see your OB during your pregnancy, usually we can capture patients and make sure that they're up to date with their screening. But many patients assume that when they're done having babies, that they don't really necessarily have to go into their gynecologist any longer. And unfortunately, really, we're missing out, I think, on our ability to keep up with screening. And screening really it's a fantastic way to detect these early lesions. I use the analogy of a pap smear as like a giant fishing net. And so we're trying to cast out and capture all of these precancerous changes and even early cervical cancers that can't be seen with the naked eye. And so during that test, if we see something abnormal, so abnormal appearing cells, or the presence of the virus that actually causes cervical cancer called human papillomavirus, then we can do an actual test to see if there are presence of these precancerous changes or an early cancer. And then we can do a treatment.
Dr. Willmott, let's talk about your recommendations. You recommend a pap smear and an HPV test every 5 years after the age of 30?
If you're a woman who has all of her life had a normal pap smear, after age 30, we can do what's called a co-test. So we can test for both the way that the cells look under the microscope, as well as look for the virus that is actually going to cause either cervical precancer or cancer, called the human papillomavirus, or HPV. So when you think about a screening test, the goal is that we're trying to identify a precancerous change, something that we can treat usually with very low risks, very simple strategies, simple surgeries or procedures, and that can hopefully prevent the progression to a cancer. So in general, more advanced cancers still have the chance of being cured, but they typically employ treatments such as radiation and chemotherapy to allow us to get to the point of cure. Cervical cancer actually is the #1 leading cause of death in the world for cancer-related deaths for women. And that is really because, unfortunately, in third world countries, they may not have access to screening that we have in places like the United States. So screening is absolutely pivotal to help prevent progression to cervical cancer.
Dr. Lindsay Willmott from Arizona Oncology, thank you so much for having this important conversation with us, and we wish you good health.